In this video, we will review the paranasal sinuses. But let's start first by defining some terminology. The prefix para means near or alongside something. Nasal is referring to the nose or nasal cavity, and sinus is a cavity or a space. So these paranasal sinuses are a series of cavities or spaces located near or alongside the nose or nasal cavity. There are 4 groups of sinuses, and they're each named for the bone with which they're located within. These sinuses have 2 general functions. One is to decrease the overall weight of the skull as they are hollowing out the bones they're located in, and they add resonance to our voice. So let's look at these sinuses individually. And I want to provide some orientation here. I have removed the right side of the skull, and I've faded the left side of the skull so we can see the underlying sinuses. Now you can see over here the names of the 4 sinuses. We have the maxillary, sphenoid, frontal, and ethmoid. Let's begin by looking at the frontal sinus. The frontal sinus is located within the frontal bone, and if you pay close attention, you can see that both of these sinuses, here and here, are located superior and medial to both orbits, or the eyes. Inferior to the frontal sinuses are the 2 largest sinuses called the maxillary sinuses. There's the right one, and here's the left one. If we turn and look towards the posterior aspect, within the sphenoid bone are the paired sphenoidal sinuses. One there, and if we turn a little bit more, we can see the other one right here. These sphenoidal sinuses are located just inferior and anterior to the sella turcica, which is right here. And then finally, the ethmoidal sinuses, also known as the ethmoid air cells, are unique compared to the other 3. While the other 3 came in pairs, the ethmoid air cells, which are located here on the right side and over here on the left side, can be broken up into as many as 18 small ethmoid air cells in the adult. Each of these different sinuses are lined by mucus-producing cells, which is why here they're covered in this pink color. They produce mucus, and each of them have little connections or apertures that take that mucus and open it into the nasal cavity. This means the mucus produced in these sinuses gets recycled into the nasal cavity and then is digested. If at any time this passage between the sinus and nasal cavity is blocked, the mucus will still be produced within the sinus, but it is not able to then be transferred to the nasal cavity, and this leads to a buildup in pressure. So if you have ever experienced a quote-unquote sinus headache, you yourself have had a buildup of pressure within one of these paranasal sinuses.